Non-weight-bearing assessment of the ankle joint is a popular open kinetic chain patient assessment. The ankle joint is formed by the tibia, fibula, and talus, and allows for dorsiflexion and plantarflexion of the foot in the sagittal plane. Non-weight-bearing examination of the ankle involves range of motion assessment of the available dorsiflexion and plantarflexion with comparison to normal values or the patient's required values. These values may differ for the patient to be pain-free with optimal function. Results are assessed for signs of impingement, sagittal plane block, or Equinus. Quality of motion assessment of the feel of the joint through its range of motion, for presence of pain or crepitus, restriction or hypermobility, and assessment of the end range feel, soft versus hard, for sagittal plane blockage type if present. Symmetry of motion assessment, bilateral comparison to identify any asymmetry of function. Clinical tests can be performed with the patient either prone or supine, with the knee both in a flexed and extended position due to the anatomical origin of the gastrocnemius. Comparison to normal published values is common. Non-weight-bearing passive joint results are combined with the active joint assessment, functional tests including the lunge test, and gait observations, as the ankle plays an important role in all phases of gait. Management options are dependent on symptoms, type of block, and treatment-directed testing, and may include physical therapies, footwear choice for optimal drop, or heel raises. For more information on DOLA Orthotics, visit dolaorthotics.com. Subscribe to our YouTube channel or follow us on Instagram or Facebook.